very much. Thank you, Andreas. Thank you, Bill. This is my disclosure. In Italy, we started pretty early with ACI and MACI. It is now 25 years that we have been using ACI. We have good results. We know that we can have long-term good results. And also with MACI. I started MACI in 1998. In the United States, that started a few years ago. But there are some problems related to MACI because we need 2 surgical procedures. There is a high cost, cell cultivation, we need a scaffold. That's why the idea was why not to use BMAC, and in 2005 I started using the cartilage implantation in one-step surgery with BMAC and a scaffold. Why hyaluronic acid-based scaffold? Because it's easy to use, it's an optimal support, helps cell differentiation, and it is very friendly with human body. Can you advance my slide, please? Is cell cultivation necessary? So we need 1-step or 2-step surgery. We published this study. We use the same scaffold. In one scaffold, we put BMAC, in the other one, like MACI, we had chondrocyte, and we follow up for 4 years patient. At the end, we found no difference at long term. But there are some advantages using BMAC ACA. Because it's 1-step surgery, because we reduce the surgical time, we reduce the cost, and we don't need 2 surgeries. But it's so important, the number of cells, like Konrad Sliniarski said. We know that there is no correlation between the number of mesenchymal stem cell or the colony-forming units and the long-term clinical results. MSC works differently. They have a trophic effect. And we demonstrated this. So cartilage in my life, during the last 25 years, I studied different techniques. And we publish now 15 years of experience with BMAC. We know that BMAC is, with HA, superior to microfracture in one-stage cartilage repair. And we published these results on the American Journal of Sport Medicine. We know that we can have good long-term follow-up results. We follow up a group of patients treated with HA BMAC for 10 years, and we are publishing these results. And we know that in this group of patients with single and multiple lesion, large lesion, because the size was more than 6.5 square centimeter, we can have good, successful outcome. And these results are comparable by age, lesion characteristic, and associated lesion. We had a significant improvement in pre-op versus 2 years and pre-op versus final follow-up, so at 10 years results. And we found no correlation with the lesion size, so we can treat really large lesion with this technique. This is the Tegner score and the Coos score, and you can see from pre-op to 1 year, 3 years, 5 years, 10 years, the results are stable. This is a second look arthroscopy. Can you start the video, please? At 24 months, showing good coverage of the lesion. And this is a second look arthroscopy in a large patellar lesion at 3 years. And this is another second look arthroscopy at 6 years post lesion in a very large patellar lesion. So in conclusion, I think that ACI BMAC can provide good to excellent clinical outcomes at long-term follow-up in the treatment of large full-thickness cartilage lesion, up to 20 square centimeters, we call a biological arthroplastic. HA BMAC leads to comparatively successful long-term outcomes in small or large lesion, single or multiple lesion, treatment lesion in 1 or 2 compartments. What is important is to treat associated lesion and to take care of malalignment. At long-term follow-up, these outcomes can be comparatively more successful in younger patients, so start early if possible. I just want to say that with this scaffold, we treated more than 6,000 patients in Europe, so it's well known. At the end, but it's not the really and the cost of cartilage repair. In Europe, we have to deal with the cost of this procedure. And if you consider ACI and MESI, we did a study, and in the United States, the cost of ACI or MESI can range from $53,000 to $94,000. While if you use this scaffold like Hyalofast with mesenchymal stem cell and BMAC, the total cost of the surgery can be around $9,000. So there is a huge difference. So one-step surgery, where are we now? This is not the end, for sure. It's not even the beginning of the end, but perhaps this is the end of the beginning. If you want to know more about this technique, I suggest you this book by Orthopaedics, and I invite you all in my second city in San Diego in January. We will have the summit, ICRS summit, all on orthobiologics. Thank you very much for your attention.